You are seeing the lymphadematous leg. This is more or less a normal leg. This is the lymphedema affected leg. Actually, he has undergone more than 1 week of treatment, so this has reduced. If you see this photo, you will know that this is the amount of reduction you have seen. This is lymphedema. Lymphedema happens because in the case of filariasis, what happens? The mosquito bite happens and then microfilaria will stay on the skin and get into the skin, and then they get into the lymphatics, and either they release antigens there and cause some destruction of the lymphatics at the tissues, or they move to the lymph node here, and they mature into the worms there. They cause destruction in the lymph nodes, and essentially the released toxins, or I would say rather antigens, they cause the dysfunction of the lymphatic vessels and the lymph nodes. Eventually the lymph starts accumulating here. When lymph starts accumulating here, the tissue starts expanding. When tissue starts expanding, lymphatic vessels tries to push the lymph back again and again, more and more towards the heart, and eventually they fail. The lymphatic vessels eventually they fail. When they fail, they become dilated. They become dilated. When they dilated, their wall function is lost, and the lymph starts accumulating. When the lymph starts accumulating, they cause the structural destruction inside the tissue. It can be the pressure on the small molecules, what we call MMPs or collagen, or those things. Either they increase, their deposition increases, their tissue environment changes, and it attracts the macrophages, and it increases, more lymph comes and inflammation starts happening, cytokines come there, and lot of activities happen inside, and eventually it starts increasing. What happens when it increases? The skin which you see normally here, this is actually looks normal, but of course it's after treated, looks normal, but actually inherently this skin is not functional properly. So you can see some changes which are happening. You can see the changes here. You can see the changes here. There's a thickening which happens, we call acanthosis. A epidermal function of the skin is lost, so it can open up into the ulcers like this. And when the ulcers open, sometimes because this toes becomes bigger, this becomes, you can see this, the space between the toes, the intertrigo is developed. This intertrigo can allow the bacteria to get inside, and the whole thing can become red. This is called inflammatory episode or cellulitis. And the patient can develop fever, they can become intensely shivering, and they become very ill, and they need hospitalization. When we give this oil massage and our integrated treatment, that is reversed. First thing what we do is that we give a good wash with soap and water for this and maintain the good hygiene for this limb. Second thing is our team members will pour Fanta on this, and again they will clean, because so that any damages to the skin is rectified. Subsequently, if there is bacteria, entry lesions like fungus is there, wound is there, then we treat the ulcer, we treat the intertrigo, and then we pour the oil on this, and then we massage it towards thigh upper side. Then a bandage is given. In between, they go into an exercise or yoga exercise. They breathe, they do the asanas, so that all the joints and all the muscles of the body from below upwards is activated. So this is briefly our treatment for lymphedema, integrated treatment, which reduces the limb size. Usually big limbs require about 2 weeks of treatment. Supervised care, we say. We give the treatment here. So when we give the treatment here, they learn all the treatment and they go back and practice at home.